He's told me not to spend any money on it.
Was that
Five.
Senate Appropriations, February 11th? We're going to fiscal year 27 budget request, and we have legal aid.
Good
You
afternoon.
could introduce yourself.
My name is Bessie Weiss. I am interim executive director for Vermont Legal Aid. And thank you very much for having me this afternoon. We really appreciate the opportunity. Vermont Legal Aid as a whole, with its sister organization, Legal Services Vermont, provides the core of this state's free civil legal assistance efforts and has served in that role for almost 60 years. I'm here today to speak to our budget request for state fiscal year 27 and to highlight that the governor's proposed budget does not maintain level funding for Vermont Legal Aid. Specifically, it proposes eliminating the appropriation that funds the Medicare advocacy project known as MAP. This program has been part of Vermont Legal Aid since it was established in statute in 1989, and VLA has since held long-term contracts with DEVA to operate it. My testimony today will begin by focusing on the Medicare advocacy project and the critical importance of restoring the funding for this program in the budget. I will then address our broader budget request, emphasizing the essential role Vermont Legal Aid plays in meeting a wide range of legal needs at a crucial time for Vermonters. The purpose of MAP is to ensure that dual eligible individuals, those eligible for both Medicare and Medicaid, receive the Medicare coverage to which they are entitled. When MAP finds a provider who is billing Medicaid for a service when instead it should be billed to Medicare, MAP works to recover those healthcare costs to the state. With the massive federal cuts to Medicaid in H.R. 1, known as the Big Beautiful Bill, securing federal Medicare dollars for Vermonters' critical healthcare is now more important than ever. I would like to tell you about some of MAP's accomplishments. Since 2000, recovery for the state has exceeded what Vermont Legal Aid has received by roughly $3.4 million. Some significant accomplishments for MAP was the success of a class action lawsuit MAP helped to win with the Center for Medicare Advocacy in Connecticut. The named plaintiff, Glenda Jimmo, was a resident of Lincoln, Vermont. In a 2013 settlement, Medicare agreed that it would cover maintenance, nursing, and therapies for people with conditions that would not improve, people with ALS or Parkinson's disease or paraplegia, thus expanding Medicaid coverage for millions of people across the country. Prior to that case, Medicare covered services only if there was, but it had an improvement standard for covering services. MAP appeals have been critical in getting Vermonters access to better health care in facilities, critical home health care paid for by Medicare. Over the years, the VLA has done this work. There has been a large shift to Medicare billing for home health care, resulting in a reduction of Medicaid billing from home health of $2 million from 10 years ago. Home health care avoids expensive longer stays or readmission to skilled nursing facilities. Therefore, we were shocked to learn 2 weeks ago by listening to testimony in the House Appropriations Committee that the governor's budget proposes to eliminate MAP. This comes despite VLA being awarded a new 5-year contract in November after a competitive bid, and without any communication or warning from DEVA about canceling the contract.
Who was that contract with DEVA?
Yes, with the Department of Vermont Health Access, yes. While it is true that the contract price has exceeded recovery in recent years, there are multiple reasons for this. At the onset of COVID, we were directed by DEVA to cease recovery efforts for several months. Recovery from skilled nursing facilities remained difficult with the ongoing disruption of COVID in the years following the pandemic. The Genesis bankruptcy of July 2025 affected 9 skilled nursing facilities, resulting in MAP's freezing of over $200,000 in potential funds. Medicare Part C plans added a whole additional layer to billing appeals. There would be the appeal to the Part C plan that had multiple layers, and then there'd be the appeal to the Medicare that also had multiple layers. And that made it much more difficult to successfully appeal wrongly denied claims. And as we all know, Medicare Part C plans now left the Vermont landscape. Which brings me to what MAP is working on right now with EVA to improve recovery. In our bid last fall, we acknowledged the challenging landscape of declining Medicare reimbursements, and we proposed solutions. These strategies are currently being implemented, such as meeting with EVA staff to discuss ways to improve data collection and provide education and provider education. Holding a training just last month for EVA's provider relations staff to train on Medicare coverage standards. We have plans for multiple training sessions with healthcare providers on the importance of proper Medicare documentation requirements for successful appeals. We have plans for quarterly meetings with EVA to review data quality and progress. And right now, between open cases in 2025 and last month, MAP is currently pursuing over 1.1 million in Medicaid recoupment. Finally, we don't believe the state has complied with the statutory criteria for ending MAP. The statute requires 2 criteria to be met before the commissioner of EVA is permitted to end the contract for this work. Those criteria are the amount of the state share of recoveries during the preceding year did not exceed payments, and the commissioner determines based upon information from the contractor, providers, areas, agencies on aging, the triple A's, and others affected by the program, that it is not accomplishing its goal of protecting dual eligible individuals from improper denials of Medicare coverage. And that authority is at 33 Vermont statutes annotated section 6703. In addition, it seems unlikely that plans currently exist to bring this work in-house to EVA. Given the newly awarded contract, so lack of the commissioner's determination, and the level of expertise that is needed to do the work. The team of attorneys and paralegals assigned to MAP at VLA are experts in Medicare and Medicaid law. By losing MAP, Vermont would lose its billing watchdog. It is easier to bill Medicaid, and there is every reason to believe providers will then increasingly do so. If MAP funding is not restored, Vermont Legal Aid would lose over $525,000 in state fiscal year 2026. Such a hole in our budget would have ripple effects beyond the loss of MAP. It would require further staff layoffs. And it is important for the committee to be aware that the attorneys for MAP also do vital work in other areas such as the Elder Law Project. We can't overstate how critical it is that the legislature restore MAP funding in the budget. And we would be happy to report back to the committee next January on our progress. And unless there are questions right now, I can move on to the rest of our budget requests.
Just wondering what was the rationale you were getting for reduction?
For the elimination of, we were not given a rationale. There's been no communication from DEVA about this at all, although I do, that we found out in some ways by happenstance, having listened to some testimony.
Okay. Is legal aid within agency of administration, because they're not anywhere else, they're by yourself. You're just contracted, you're not.
We're contracted. Yeah. Correct.
All you're not something else.
We're a nonprofit, yeah.
The question is, I think his question is the payment that goes out for the contract. Who does it come? Which department does it come through?
EVA.
It's all, you don't have other contracts through other parts of state government.
We have our other major contract is with the agency itself, the Agency of Human Services, and that's the contract that I'll be talking more about in just a moment. And it's the contract that provides funding for both mandatory legal services and general legal services. And when I talk about mandatory, it means like our involuntary mental health treatment, in guardianships for people who are developmentally disabled. And as we have not received any inflationary increase over the past few years, the part of the contract with AHS that covers those mandatory services has grown, while has taken up a bigger proportion, while the portion going to the more general legal services is of course shrinking. And I'll move on now to the rest of my testimony. As I stated, BLA with Legal Services Vermont are the only providers of a range of core legal services throughout the state. We offer free legal advice and representation to low-income Vermonters from 4 offices located across the state. We operate a statewide legal helpline providing quick legal advice, information, and referral. We maintain a website that guides Vermonters on how to solve their legal problems on their own that gets over 600,000 hits per year. We field around 26,000 requests for legal assistance every year. And last year, we directly assisted 18,000 Vermonters. And we provide full representation in approximately 2,600 to 3,000 cases every year. Despite the overwhelming need and increasing demand for legal services, this will be our 3rd straight year that we have not received an increase in our appropriation from the Agency of Human Services. And level funding is hitting us especially hard because of significant federal funding cuts and annual increases to our costs, especially in healthcare insurance premiums.
Is it an appropriation or is it a contract?
It is a contract, but we do have a line, it's an E300 in the budget, and we have lines in the budget in different spaces, in different places, but one of the places at E300 where most of the AHS funding that goes into that contract is located there.
In that line.
And then there's more in DMH's, the Department of Mental Health budget.
What did you say was E what?
300.
E300.
An increase in our state fiscal year 27 appropriation would compensate us for inflation, restore 2 staff attorney positions in our poverty law project, provide better statewide access to our chronically underfunded helpline, as well as fund a vital new project that helps migrant families stay together. The Poverty Law Project provides general legal services, and as I was saying, is being squeezed as a greater percentage of our appropriation goes to mandatory legal services, such as involuntary mental health treatment cases, protective services, guardianship cases, and Act 248 cases. The vast majority of Vermonters cannot afford legal counsel. They need attorneys and access to legal help, especially at a time when the state is investing heavily in housing stability and healthcare. Vermonters need advocates and lawyers to help them navigate these complex systems. Vermont Legal Aid provides that guidance and representation, helping people stay housed and provide access to healthcare and benefits they have earned and are entitled to. Moving on to our helpline, our statewide helpline fields 26,000 calls every year. It provides Vermont Legal Aid with many of our case referrals and provides some level of direct assistance to approximately 18,000 Vermonters, but it is significantly underfunded. The helpline receives just $100,000 through the AHS appropriation. The total operating cost is over $900,000. Due to the reduction in staff, we have already needed to restrict the types of calls that receive a callback, and callback time for non-urgent calls has increased to almost 2 weeks. Moreover, there's been a surge in demand by more than 100% since 2022. Without additional funds, helpline services will likely be further eroded. Increasing funding for the Poverty Law Project and the Legal Helpline is a good investment for the state in 2 ways. The first is that for every dollar spent on general legal services, access to public benefits, food, energy assistance, social security disability benefits, and housing, the Agency of Human Services gets 50 cents back in federal matching funds. The second is that a 2019 study commissioned by the Vermont Bar Foundation found that legal assistance programs generate $11 in economic activity for each dollar invested in Vermont legal aid and other legal assistance providers. And that makes sense if you think about it for a minute, because by keeping people housed and receiving the benefits to which they are entitled, they can continue to be productive and they can help the economy. And our last request is around a new program, the Immigrant Minor Guardianship Program. In February of last year, Vermont Legal Aid responded to the needs of the immigrant community by establishing a program to help families make a plan in case of family separation. VLA staff and trained attorney volunteers meet with immigrant families who have a trusted relative or friend and fill out guardianship petitions that would take effect should the parents be detained or deported. Since this work began, plans have been established for over 75 families and over 130 children. Without a plan and a guardian, children would likely end up in VCF custody and would unlikely be reunited with their parents in a foreign country, since DCF cannot do any home visits or work with foreign governments. This work is not eligible for funds through the Immigrant Legal Defense Fund, since that fund is reserved for providing legal representation in deportation cases. Therefore, the work is largely unfunded and costs legal aid approximately $150,000 according to our budget analysis. As I said, we already lost staff last year. Even without the loss of that funding, we are looking at another deficit budget. The loss of over 0.5 million in that, combined with no additional funds, would be devastating. We would lose more talented and dedicated staff, and our ability to continue to serve as the core provider of free civil legal services would take a substantial hit. And the outlook for federal funding is bleak. Congress will cut funding to the primary funder of legal services, Vermont, our sister organization, by 3.8% for their current funding year. And there have been threats to the federal funds that support the Disability Law Project. And despite having been awarded a fair housing grant through HUD after having them eliminate that grant after 19 years of funding us for fair housing work, we were once again awarded the grant in September, but we've yet to receive the funding. And it's very difficult now to reach any people in HUD to move that grant forward. We understand that you are facing unprecedented challenges this session, and we appreciate the funding you received through the state and with your help. Thanks again for the opportunity to speak with all of you this afternoon.
Thank you. That's important to know. So was the 2.6 million the total between the different contracts that you received? Where is that number?
The 2.6 million is the total between the AHS funding for the mandatory and the general legal services, and then Department of Mental Health funding that came at a time when the work to our mental health law project increased, because they took on representing people who were judged incompetent to stand trial. And let me see, is there anything in addition to that? I think that covers it.
Okay, that'd be great. Yeah. And how many total staff?
We have about, it's been fluctuating right now. We have about 80.
Where are your offices now? I remember they used to be just down here, down quick.
But there's one in Montpelier. It used to be close,
Right.
really close by. It's now near Vermont. fine art, the college.
No Greenway. Yeah, called Vermont College of Fine Arts, but now
Yes.
it's like Green.
Yes.
Yeah.
Yes. So it's right up there. We have an office, Rutland, we have an office in Springfield, Burlington. And to save some money, we, closed our St. Johnsbury offices, but our St. Johnsbury office, but we're doing local clinics there and have a space we can use at the AAA's.
Councilor Watson.
Thank you. So in the contract that you have with Diva for this work, that contract is just for the MAP funding, or is it for all? Well, it would be. I guess my question is are any of these items broken out in that contract?
So the MAP contract.
Yeah.
Is for that precise amount.
It's just,
And that's the Diva MAP.
and that's
contract.
just that line.
That's correct.
And that's the one that they cut,
Yes,
canceled the contract.
yes. After having just awarded it to us in November after competitive bid
And without explanation.
without explanation.
And these,
We'll have to ask the,
and then where do these are the other items here, your either where do those live in
So sure, thank you. The inflationary increase and the 2 FTE is staff attorney restoration that we're requesting, that would be then added to the AH at the E300 line item. That's the item, that's the area that has been level funded for 3 straight years. And therefore, that's why that the poverty law project has been squeezed. And the helpline funding was where that is, there's $100,000 that was given, that was provided for the helpline several years back. And I'm not exactly sure where it is. But it is very expensive, and we both organizations try to make it work with the little bit of discretionary funding that we get.
any other organization being poverty loan.
The other organization is our sister organization, Legal Services Vermont. That's the LSD organization, Legal Services Corporation funded organization in Vermont.
and one other question. So the immigrant minor guardianship project, where is that funding coming from now?
We really, the only funding we have for that right now is about a little less than $30,000 in donations. And the services are the requests for those services have picked up significantly in the last few weeks.
Yeah. So so the 150 is what it's costing year remotely. And so is that
It's the staff time, the
Sure.
training time, the
And so-
planning time.
and so but that is also a part of your ask from the state.
It is,
Yeah.
we at least want to make people aware of the work and that it is unfunded and not sustainable. That maybe another, we have an MOU with the DCF to do the work, and this, that's a cooperative relationship and communication lines between us, because DCF very much wants us to do this work for probably reasons that are clear to you, that it avoids kids ending up in custody. So I don't know if there's any chance that there's any funding through DCF that would help fund this work. But
I just want to appreciate all of the work that
Yeah.
you do, and especially in the times that we're in right now, that work particularly. So thank you.
Thank you.
Any other questions? Yeah, thanks for your support of Vermonters. You also said that to L, that breakdown?
Yeah.
Okay.
Thank you very much for having me.
Thank you.
Sure.
Well, one before we start the announcement is the BA was on notice today, but so we normally take it up tomorrow, but we have our public hearing at 1:45. That just gives us like 45 minutes or whatever, half an hour to do the presentation.
So you're gonna stand up and tell him to just shut up, he goes, well.
That's what I proposed. The pro temp thought it would be better for you. No. Oh, no, we do have it. Well, you already got it. You got it. So we're gonna do it Friday and then Tuesday for third reading. Just FYI,
It's exciting.
hope so.
Cause y'all weekend.
I know, I got